Good morning. Welcome, and thank you for joining us for our Northern Light Health, Good Health is Good Business Zoom conference. We are currently in the improving phase of the Omicron surge. We've seen improvement before and learned that there may be more to the story. We'll take a look at what we know today and what we are paying attention to anticipate the future. We'll then hold a roundtable discussion with executive leaders representing 4 organizations. They will share their experiences and lessons learned during the pandemic. I'm Dr. Ed Gilkey, Senior Physician Executive at Northern Light Beacon Health. I'll be your moderator for the next hour. Our panelists today are Bob Montgomery Rice, President and CEO of Bangor Savings Bank, Robert Tracy, Executive Vice President of R.H. Foster, Scott Oxley, President of Northern Light Acadia Hospital, Dr. Jim Jarvis, Director of Clinical Education at Northern Light Eastern Maine Medical Center and Senior Physician Executive of COVID-19 Incident Command at Northern Light Health. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation, and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. A reminder, this hour is for you. If at any time you have a question for our panelists, please use the Q&A function. I'll keep track of your questions and have our speakers respond. Also, I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. Dr. Jarvis will start us off with the latest on COVID-19. Dr. Jarvis?
Thank you, Ed. So I wanted to start off by just kind of saying that we are moving in the right direction at the current time. This is the map produced by the federal CDC that talks about the community level risk for each particular county. And you can see that across the United States, most of the counties in the United States are in the green. Many of them are in the yellow and a few are shaded orange, which is really more of the red category. And you can see up in Maine, we kind of follow the rest of the nation with that same kind of spread where most of our counties are in the green and several of them are in the yellow. Unfortunately, Aroostook County remains in that orange color, which is really represented of red. So next slide, please. But we're not out of the woods yet. If we actually look at true case counts per 100,000, we see that most of the state of Maine actually remains in the substantial or high risk category for number of cases of disease. Good news is that most of these people are having mild symptoms and are not requiring hospitalizations, that we continue to see hospitalizations not only across the United States, but here in Maine decrease due to COVID-19. However, I will remind our viewers that we continue to have a stress to our healthcare system in terms of capacity at our hospitals for reasons unrelated to COVID, or at least acute COVID, as we are seeing an increase in the number of people who have had COVID 1 or 2 months ago, who are now presenting with conditions, particularly cardiac conditions, that are probably related to that acute infection, but they are no longer acutely infected. Next slide, please. So how do we understand what these low, medium, and high, or green, yellow, red categories mean for each of our counties? In the high category, it means there's still a high level of severe disease, and there's a potential for the community's healthcare system to become strained. It's also meaning that everybody wear a mask while indoors and in school, and additional precautions need to be taken. In the medium category, it means there are less people with severe disease, and you're starting to see that the effect on the healthcare systems are improving. This is really what we see across most of Maine. And then the low category is simply that the virus has limited effect on the healthcare system and low level of disease. Next slide, please. So what does it mean for you in each of these community areas? In the low risk category, we say people need to remain vigilant, get their vaccine if they haven't been vaccinated yet, and get tested if they have symptoms. In the medium category, if you're at high risk for severe disease, you should talk to your healthcare provider about what situations you should do to protect yourself. For my patients, I recommend that they continue to wear masks while they are indoors in public places and in any other time when they feel that they would be at risk of contracting the disease from unknown people. They need to obviously stay up to date with their vaccines and also get symptoms. And then in high-risk counties, the recommendation is that everyone wear a mask, regardless of vaccination status, while they are indoors, and that includes in schools as well. And they should get tested just like we talked about for others. Next slide, please. So I do want to put a word on masking because we continue to hear, particularly in areas of the media and sometimes, unfortunately, from politicians, that masks don't work. And that is patently false. In fact, here's more evidence that universal masking works. There was a study that was recently published by the CDC talking about mandatory masking in schools and that it reduced the cases of COVID-19 during the Delta surge. And I want to stress this was during the Delta surge and not during the Omicron surge. But the NIH funded a study that involved more than 1.1 million students across 9 states. Those states were North Carolina, Wisconsin, Missouri, California, Washington, Georgia, Tennessee, Kansas, and Texas. So certainly a smattering across the country, both red and blue states, both rural and urban centers, and a huge number of students, 1.1 million students. And what they found that schools that had mandatory masking saw approximately 72% fewer cases of in-school transmission of COVID-19 when compared to schools where there were optional or partial masking policies. That is tremendous decrease in the number of cases from transmission from student to student, student to teacher, or teacher to student. Most cases, however, of COVID-19 infections in either group occurred through community spread. And often that's because once kids left school, they stopped wearing their masks and therefore were more susceptible. So once again, masks work. And with that, I think our last slide is just really just showing where you can go to get more information on how you can get vaccinated, boosters, flu shots, or actually learn more about treatments that can happen for COVID-19 infections. And with that, I'll turn it back to you, Ed.
Well, thanks, Jim. I have a couple questions for you. So it's clearly feeling like things are improving, but what's your take of what's going on in Europe these days with rising cases?
Yeah, and that is a concern. As we've seen in the past, Europe seems to lead before the United States. And so we've seen with all of our surges that at least certain countries in in Europe, particularly the United Kingdom, has kind of predicted what happens here in the US. So far, we haven't seen that with what we're seeing in Europe, because several countries now are several weeks with a new significant rise in cases. It's unclear as to what the cause of those rising cases are. It may be part of the BA2 subvariant of Omicron, that in some way it's acting a little bit differently than we see with the original Omicron strain, which of course is 3 mutations away from our original strain that we talked about 2 years ago. It may be that vaccination rates or vaccines are waning, and in most of Europe, they were vaccinated prior to the United States. They also have a much higher level of vaccination in the United States. And it may actually be that's what's triggering it, that here in the US, many individuals who were unvaccinated were actually infected with the original Omicron strain, which is probably giving them some limited protection right now against the BA2 variant. So it's really complex. And what it really means is we really need to continue to be vigilant, watch for trends. We do know that there are some hotspots around the United States where case counts are increasing. Many of those cases are due to that BA2 variant. Thankfully, we have not seen that the BA2 variant in the United States has caused more significant disease than we saw with the Omicron variant before. So that's good news for us. It bears watching. Right now, I'm pretty comfortable in saying that I think the next few weeks are going to be probably good for us here in the state of Maine. But remember, we have spring break right now for most colleges and universities in the state, and that'll be shortly followed by public schools having their spring break. We know travel occurs, and we know that following large travel times, we usually see a significant increase in disease. And so just needs to be vigilant. We need to watch it. But right now, things look much better than they did 2 weeks ago.
So we have at least a couple weeks reprieve coming to some degree.
I think so. And of course, warmer
Yeah.
weather, more daylight, all of those things improve us in terms of people going outside. And when we're outside, less likely to get infected.
So when we look at other parts of the world, like New Zealand in particular, and then Hong Kong with a zero COVID policy coming out of mainland China, and then also Australia, particularly Western Australia, which did a complete lockdown for a rather long time, like New Zealand did. Now that they've opened up, particularly New Zealand and Hong Kong, you're seeing this exponential growth in cases, presumably the Omicron. And in Hong Kong, we're actually seeing a lot of deaths. And that might be related to the fact that we didn't develop immunities in that population like elsewhere. So I think the point of bringing that up is to make sure that we have appropriate respect for Omicron. We've heard so much about mild disease, and those of us closer to it clinically recognize that that's just an artifact, actually, of the immunity that's available in the community, and not so much the functionality of the virus. You care to comment on that?
Yeah, I would take a little bit of caution when looking at Hong Kong. Their rates of vaccination are extremely low compared to many other Western cities. And so I want to just kind of put that out there. New Zealand and Australia both have relatively high vaccination rates, but as you said, it may be that they're more strict mitigation strategies actually now are seeing the ramifications of that because they had fewer people who got infected earlier on, and so therefore have no natural immunity added to vaccine related immunity. So that may be what we're seeing there, and it may just simply be a factor of they just saw less different variants before, and so for them this is the new variant, much like we saw here with both Delta and Omicron in the United States as being significantly different variants than we had been exposed to. All of it, again, just as we don't know a lot about this virus, we continue to learn every single day. And as we've talked about, viruses find a way to infect people, and they will continue to find a way to infect people. And again, those are some of the concerns that we have. I would probably be more concerned about what's happening in Africa right now. So Africa really has been spared during most of the pandemic relative to the rest of the world, but that's not what they're seeing now. And again, vaccination rates in Africa, other than in South Africa, are extremely low. In some continents and some countries, only 7% of the population is vaccinated against coronavirus. And therefore, they are a great place for new mutations to occur. And again, with world travel, that just means that it takes one person on a plane going to one particular area, particularly an area with a dense population, where we start seeing something else. So I think Africa is probably where I'm more concerned and watching out for the next wave from the pandemic from a new variant.
Yeah, and some of the information you shared, particularly with the low immunization rate in Hong Kong, but high death rate, I mean, that really reinforces the need for vaccination primary series as well as the boosters.
Absolutely. And so for individuals who have yet to be vaccinated, I still encourage them to do so. It's kind of like we talk about with flu season. I just vaccinated one of my patients against influenza just this week because he just didn't get it when we normally would recommend it. And he's like, well, is it too late? It's never too late. Okay. It is never too late to talk about preventative medicine. And with coronavirus, absolutely specific that we need to that we need to continue to get people vaccinated. And if you're eligible for your booster shot, I strongly encourage you to do so. A study after study now has shown that having that booster shot, whether it's your third shot for a messenger RNA vaccine or second shot if you just received a single dose of Johnson & Johnson, gives you very good protection against both infection, but really against severe disease, hospitalization, and death.
Excellent messaging. Jim, just one more question. Talk a little bit about Pfizer has put in data to the FDA for consideration for a fourth, which will be a booster shot of the mRNA vaccine. What's your take on that?
Yeah, so I am one that certainly wants to see transparency and definitely wants information getting out there, but sometimes information gets out a little bit too early and interpretation is a little bit off. And so if you actually dig deep into what the CEO of Pfizer said, he really was talking about another booster shot for people who are at high risk or when we see another surge come, which is very similar to what the CEO of Moderna said. And so right now, what they're looking at really is a specific targeted population of individuals over the age of 65, which all along we have said those people, just due to age, is a significant risk factor for severe disease from COVID-19. I think we'll learn a little bit more over the next coming weeks. I don't think that you're going to see a big push from either the CDC or the FDA for a fourth booster at this time. I think if we get through spring and summer unscathed, you'll probably hear about that in the fall as being protection against seasonal coronavirus. It'll happen before that if we see some change and shift in the way infection rates happen here in the US, that maybe that'll come beforehand, or maybe it'll be specifically for people immunocompromised or over a certain age.
Well, Jim, thank you so much for all that information.
That's all my crystal ball, so it's
I've come to rely on your crystal ball. So couple of good weeks coming at us. We don't know what's in the future based on the lag time versus Europe, but we'll pay attention and keep up our guard, so to speak. Okay, great.
Thanks, Ed.
Thank you. Our panelists will now join us on video. Thank you to each of you for joining us today. You bring a wealth of knowledge to the table. You represent a financial institution, a retail consumer goods company, and a behavioral health inpatient and outpatient delivery system. So let's get right to it. Please introduce yourself and help us understand a bit about your business. And we'll start with Robert.
Hey, good morning. This is Robert Tracy, Executive Vice President of RH Foster Energy. RH Foster Energy's been around for about 60 years, and right here in the Penobscot area. And RH Foster Energy is kind of compartmentalized into three very distinct businesses. Ed, just to give the participants a little background on that, those three distinct businesses are liquid fuels wholesale distribution logistics that services both third-party customers as well as our own retail units. The other two businesses are convenience retailing. That's really transportation fuels, where you'll go fuel up your car, and proprietary food programs. That's kind of our differentiator in the convenience world, the Freshies food program throughout Maine. And then the third one is energy service businesses. That's really where we go to residential homes and businesses throughout the state of Maine, and we service both liquid fuels. We condition space that's heated or cool it, HVAC, generators, heat pumps, solar, those kind of components for both commercial and residential businesses. And we like to say for clarification is the convenience stores, customers come to us, the energy services, we go to them. So two different distinct ways we touch the main customers.
And about how many employees do you guys have?
About 430 in the state.
Okay, great. Thank you so much. Scott, you're next up.
All right. Thank you very much, Ed. Good morning, everybody. I have the pleasure of serving as president here at Northern Light Acadia Hospital. A little bit about Acadia. We've been in business for 30 years. Actually, in August, Acadia Hospital was created as an outgrowth of Eastern Maine Medical Center to recognize a need for more resources in the state for psychiatric care. So today we are just one of two inpatient psychiatric facilities in the state. Acadia takes care of, for the most part, takes care of the northern part of the state, while Maine Health, through their Spring Harbor facility in Westbrook, handles the southern part of Maine. We have 750 employees that provide a variety of services to the complete spectrum of ages here in the state of Maine. We have 100 licensed beds, about 1,300 admissions a year in our inpatient program. On the outpatient side, we service or provide about 230,000 outpatient encounters every year. And again, we provide services to the full spectrum of ages, whether it be the youngest of the pediatric population through the adult population and the geriatric group as well. Historically, we've been best known, I believe, for inpatient services here on Stillwater Avenue in Bangor, and those services have provided a statewide set of services to all people from Maine. Only about 37% of all of our admissions come from Penobscot County. So about 2/3 of our admissions come from the entire state of Maine. But really our focus over the past year has been in the outpatient sector. We know the key to our success as a delivery system and a provider of behavioral health services needs to be centered around a more prevention and early detection and early intervention of behavioral health services. So we've been working diligently to stand up more outpatient services by reaching deeper into the communities, such as today we support 50 primary care practices with behavioral health professionals, either in that space physically or virtually. We support 13 school systems. We support 19 emergency departments through the state, where all of you, I'm sure, have read more and more about the lack of behavioral health resources in the state, which forces people and causes people to use their emergency department as their default place of care for behavioral health services. So in many situations, it's the folks from Acadia supporting their needs. And equally as important, it's not our largest service line, but a growing service line with a great deal of importance. It's our Healthy Life Resources program, where fortunately, about 30 months ago, we stood up a program just prior to the pandemic where we have direct to employer services available in the community for anybody that needs our services. And those services and resources have been invaluable to help employers and employees through resiliency techniques and trainings and all the help that all of us have needed throughout the pandemic. So I'll speak more to what we do, Ed, in my responses, but that's a pretty high level overview of who we are. So thank you.
Great. Thanks, Scott. So Jim Donnelly, welcome and thanks for tag teaming with Bob and representing Bangor. We appreciate that very much. So Jim, if you would introduce yourself and help us to understand a bit about the business you represent.
Sure. Thank you, Dr. Gilkey. Yeah, I'm Jim Donnelly. I'm an Executive Vice President and Chief Commercial Officer of Bangor Savings Bank. And so we're organized in, so the number of employees we have is about 1,100 employees bank-wide. Many of those, I'd say the bulk of them are in the Bangor, greater Bangor area. We have that campus right along the Penobscot River where most of our back office and customer and employee support teams exist. We have about 65 branches that are out in the communities. We have one lending office in Massachusetts. That's our only toe that we've dipped across into that state. We have 7 branches in New Hampshire, and the bulk of what we do and customers we serve are right here in Maine. We take care of customers from the time they're little kids and are opening their first savings account on through home equities and mortgages and into retirement planning and accounts. And so we try to do the full gamut on the deposit and investment side, but we also take care of customers on the lending side and will help with most consumer side lending. So if you think of your credit cards, home equities, car loans, all the way through the different needs that you have we also have a very robust commercial lending group. And, you know, as we're talking about pandemic, one of the activities we really kind of leaned in on was the PPP during the pandemic. And we were the #1 bank in Maine in helping our neighbors and friends make it through with and get those dollars out. So we helped over 6,000 businesses in that short period of time. And just to put the relative spin on that, we usually do about 80 to 100 SBA loans a year. And we did about, and that's over the course of a year, we did about 6,000 in about 6 weeks. So we had people working, and no exaggeration, 5 a.m. to 2 a.m. every day, 7 days a week, to make sure that we were able to help our friends and neighbors. And so it's, when we volunteered at the vaccine clinic, we had a lot of employees kind of chip in to help. I, as a board member at Northern Light Health, started to think of the way that Northern Light tackled the logistics of getting the vaccine clinic and getting as many people vaccinated as smoothly as they did. I thought of what PPP did for Bangor Savings Bank and letting us lean in, get that esprit de corps on leaning in and doing what we do, was as close as we could get to what you did do on making sure you save lives with that clinic. And I couldn't imagine anything having been run more smoothly, more customer friendly, or having you come out on the other end of a very difficult time with emotion, coming out with more people saying Northern Light really did it right. So little commercial for Northern Light and what a great job that Cross Center Clinic did, and then replicating it in Southern Maine later was really quite impressive. And not only did our employees get in line the day that were available to, we also got in line to help our friends and neighbors there. So that's a little bit about the bank, a little bit about what we do. And thank you for having me join the panel. My boss, Bob Montgomery Rice, would have liked to have been here, but he had a catastrophic crash of his internet and barely had a cell signal. So I'll tell him, because it's annual review time. So everybody must report back to him that I did a good job.
Well, thanks, Jim. And we really do appreciate you stepping up. And just for full disclosure, a check will not be in the mail from Northern Light. So the first question is actually for our three business leaders here. And I'll go in the same order as the introductions for you folks. Please share one of the things you have gained over the past 2 years that you have added to your repertoire as an executive leader. So Robert, if you would start us off there.
Yes, thank you very much. Right in March 2022, when this pandemic, or 2020, when this pandemic hit us, one of the very first thing we were staring at is how can we stay in business safely and take care of our employees, take care of our customers, and take care of the business. And so just leaning into that and trying to figure that out, I immediately implemented, which I hadn't been doing in the past, communication network across our whole portfolio really quickly, so I could dial in every day and every morning at 7 o'clock, get a brief out as contact tracing. What are our conditions within every different small town we were in? Where could we support the front line? Pandemic supplies, safety supplies, how could we really be there and take care of the front line in the 3 different businesses we had? So one of those things that I implemented immediately in March of 2020, that has stayed intact. We've dialed it back, obviously, and now I do it twice a month with everybody, but that communication loop of how do we take care of the front line, how do we take care of our employees, how do we take care of the business, and making sure that our corporate support network in our corporate office is got the best information for how we help our customers and our employees both take care of themselves, take care of the customers, and take care of the business. And so that loop is staying. I think that's going to be a legacy thing that will, here 2 years later now, we're still doing it, but Monday mornings at 7, every other Monday, and it's very helpful and very viable. As this pandemic is waning down and then picking up and waning down, it's stayed a critical tool to be very responsive to the front line.
So that's a form of your communication.
Yes,
Yeah.
yes, absolutely.
Okay.
And then we made it simpler by, it started with just phones, and then we just needed to totally change our technology, and now it's right here. It's just like a remote work, and anywhere you are, you can see and hear and communicate. So radically improved our technology sector.
You make me think that, all of us read the same management book, Management 101, Chapter 1, Communication. I think that was the title, actually, right?
Yes.
And it's not until something like this to where we realize how critically important it really is. So I'm glad you brought that up right away, Robert. That's very helpful.
Well, we were eyeballs and handshakes. That's how we were running the business and writing memos and emails to communicate. Now we had to complete different system in this environment.
Great. Well, thanks so much, Scott. If you would share one of the things that you've gained over the past 2 years that you've added to your repertoire.
Yeah. Thanks, Ed. Full disclosure, I think there were many things I added to my repertoire. So I don't know.
But only one.
Yeah, I know. I don't know what that says about me as a leader prior to the pandemic, but I think I've learned a lot and become a much better leader over the past 24 months. But, you know, listening to Robert's response to your question, my response would be very similar, from the perspective that when we started in this journey of the pandemic 2 years ago, we formally sat down as a team, not just here at Acadia, but through all of Northern Light Health, and we set our goals to guide us through the pandemic, not knowing how long it was going to last. And we put together 3 very purposeful, direct, and distinct goals, much like Robert did at RH Foster. The goals were in order of priority: to protect our employees, keep them safe, keep our patients safe, and to protect the business. And we use those 3 formal goals literally each and every day for all the decisions that we had to make. And some days, like all of us out there in the community, regardless of what industry we're in, hundreds of decisions needed to be made. And I think, you know, what's true of many executives, probably all of us here in the panel today, is there's a great deal of ownership and accountability that goes along with being the president of a company, and the buck stops with us. And we take that responsibility seriously. And a lot of times, you know, we're making decisions because we're supposed to and because we have to. And what I learned pretty quickly, I've always felt I was an inclusive leader. I want input. I do respect other people's perspective, but that input and insight became exponentially more valuable immediately as we had to wrestle through all of the issues that we had to wrestle with. And in many cases, you know, as a community, especially in the healthcare space, we're dealing with life and death issues when it came to the COVID virus, on how we protected our employees and how we protected our patients. So what normally would have been a series of decisions made by me fairly quickly, and I think appropriately, I understood the value of broader insight, broader input. It became much more inclusive in my decision making. And to also accent what Robert said too, is sort of the response and the communication back out around those decision making made us a better organization, and definitely made me a better leader.
Thanks, Scott. So Jim, if you would share from your perspective, you know, one of those things that you picked up in the last 2 years that you've added to your leadership style.
Yeah, we've always organized our business with the thought of these 3 things, and to stick with the 3-thing theory, we always looked out for our employees and try to think of them first and foremost. How do we serve our customers? And then how do we serve our communities? And so thinking of the health of those 3 groups was a different twist on what we normally did. We were fortunate that we had been planning for snow days, and the way we organize our business is to be able to run a lot of our businesses when they have to drive into a centralized building, to say, we don't have to shut down certain components of what we do because the weather is bad if we let people work from home. So we had been buying some of those devices and technology and having people carry their devices home. So the day we shut the bank down basically and sent all of the back office and non-essential to serve clients home, we were able to do it. So one of the things we learned was that we could operate remotely. Right. So we very much have operated our business as Bob said, or Robert said, as a eyeballs and handshakes. And we still believe that that is a critical component of our culture and how we serve our communities. But we've added other ways that we can communicate, and the frequency of communication and the saving of hours on the road for some of those eyeball handshake times has made us, I'd say, a little bit more efficient. We've also worked on our digital and other components for our customers, so we can serve them as efficiently and effectively on their phone through a mobile app as we can in person. And so we don't want to drive people to those spots, but there is an alternate means of being served, so that we can really take good care of our customers. And Bob Montgomery Rice was particularly well read on what we needed to do to keep our employees safe. And we were frequent readers and dialing in for help to Northern Light And I think Bob and Dr. Jarvis have speed dial, and we were constantly updating what we were doing, how we were doing it. So something that banks may not be known for, I'd say we became more nimble as an organization and more flexible on how do we do things, because we were playing the same whack-a-mole as everybody. It was which county is higher today, which branch has an incident, how many days do we have to shut down, and we used to share some staff between branches, and during the pandemic, that put 3 branches at risk if one person was sick as opposed to one. So we reorganized how we were doing things. So we're constantly thinking of how do we serve the client safely? How do we keep our employees safe? And how do we communicate between each other? So we had calls 3 times a day to address the rapidly changing environment that we were having. Now we've dialed that back, like Robert Tracy said, but the opportunity for communication and how often we do it is a lot. And we also have our CEO calls after every board meeting where we share transparency on what's going on, what are we thinking, where are we going? And I think we're just going to do more and more of that. The more communication and transparency we've had with our employees, the more trust they have had with us. And I think it's made us a better organization and serve our customers better.
You know, Jim, all 3 of you had mentioned safety of customers as well as staff. You know, let's pursue that just a little bit deeper. So, you know, I think you heard from Dr. Jarvis and myself talking before that we're probably in sort of a safer zone now. You know, the numbers are all improving. It seems like the transmission has dropped off. But I think we are all, you know, well prepared with the idea that another surge can come, whether out of Africa or, you know, some other place that we don't recognize yet. Talk about that nimbleness and the safety. Like it sounds like you're bringing certain people back into the office space, we'll call it, while allowing some people to do some of their work or all of their work remotely. You know, how do you adjust that balance if we find out that community transmission is you know, skyrocketing again?
So we've moved. The branches are never really shut down. We shut down for a very brief time and only went drive-through only. And as soon as we thought we could open the branches, we did it by appointment to make sure we could do the social distancing and manage that. And now we've kept those tools by appointment, but the doors are open. But for the back office, where the density of our cubicles and offices was pretty dense in some of the buildings, what we've moved to now, taking some of the lessons, is a hybrid work environment where we do a 3-2, 3 days in the office, 2 out, and try to stagger the group and keep that social distancing a little bit. But maybe once a week, try to have the whole team in so we can still do the team building and things that we still think are important to be in person with, but keeping that home set up so you can work from home, and when do you come into office, and scheduling with your coworkers so the customer doesn't feel the effects of that change, but keeping everybody's skills that we learned during the last 2 years sharp by doing this hybrid. And we've also found that we've improved employee satisfaction, because now they can throw a load of laundry in while they're working. And so now we've made Saturdays free for people as the big benefit. So when you used to do your chores was on your Saturday, now you can, you know, when you're taking your break from your workday, you can throw your laundry in and do a couple of other things as well. And so what we're finding is the employees are really enjoying this hybrid work environment. But I think for business continuation, it's also a great skill set for us to keep up.
So it sounds like a nice balance between the business needs and taking care of your staff.
If we don't have great people, we can't give great customer service. And if we don't give great customer service, we're going to be like anybody else. So we want to make sure that we're delivering the very best we can. And the only way to do that is take care of the people that make it happen.
Well, thanks for that, Jim. Robert, I'm going to follow up some of the questioning I had with Jim here, and directly ask you a question from our audience. And recognizing that you have 3 different businesses, so you may have a couple of answers for us here. Will you require all your employees to return to the office, or will you have hybrid for all employees? So talk about that mix for your business a little bit more.
Yeah, so for our administrative corporate offices, we still have folks working remotely, those that have a need to or have a desire to, but the bulk of them have come back into the workplace. We still have our corporate offices that are locked down in the essence that the general public can't come in and out there. It's in that way. But the people who can work remotely, we still have that as an active tool set. The challenge inside is those other businesses that are very forward-facing customer businesses do not give us that toolkit. So in that toolkit is just our cleaning routines that we do. So if the pandemic picked up a little bit, the routines that we've embedded from 2020 on making it as touchless as possible. We created in the height of the pandemic online ordering where our customers could online order what they wanted, and we would curbside deliver it. So we implemented that across all of that convenience retail inside. Now that's really toned way down. The consumers are not using that toolkit today as much as they were in the height of the pandemic. And then we just really had is how much can you do in the retail facilities to minimize the touch point with your customers, and sneeze guards and payless touch points and all of those things. Those are still fully implemented in our facilities right now. We haven't dialed those back yet, but the global answer is, can we still function as a work at home or work remotely? And the answer is yes. But there's certain jobs that are forward facing that we have to be much more functional, much more dynamic in how we serve the public and how we keep our employees safe.
Mm-hmm. So just a follow-up question for you, Robert. Do you have concerns about productivity working from home in the hybrid model?
Well, I rate full transparency. I had a lot of baked in biases to that in February of 2020, March, April, May. I radically transformed those because our business really, the employee and the output from remote work really was beneficial. So in hindsight, by just going through a forced experience of a pandemic and having to take care of our employees and the business and our customer, we implemented the technology, we created the toolkits, and we offered that to everybody that could qualify for that and still work. And it was exceptional for our business model. It worked really well. And I think it's more efficient, especially people doing commuting into our monthly financial reviews, our strategic reviews, everything that we do to support the organization and our transformative change can all be done remotely. So those resources, the folks in our company that can do that and do it well, it's been a great blessing. And I think that'll be here for a long term. And I had biases to it, but those are put away. Those are gone. There was a big paradigm shift in our culture of what that means to work remotely.
Great, that's very helpful. Jim Donnelly, if you wouldn't mind touching on that topic, the concern for productivity and how you guys address that.
I think we actually found we were more productive, and there was less, people came to work a little bit earlier. They stayed as long as they needed to. At the same time that we were shut down, I mentioned one place that our business swelled, but we did more refinances and mortgages than we had ever done before. Between 2019 and 2020, we did $1 billion, yes with a B, dollars more mortgages than we had the year before with the same staff. And so it was incredibly busy. And the productivity, as you can see, we weren't slackers before. But the team stepped in, and I think their home offices, they stretched and did what would have been travel time, became productive time. If I had any worry, what I coach people now is to make sure that they have breaks in their work time when they're at home, because not everybody is as good as putting a line between when I'm working and when I'm with my family. And we think the mental health challenges that came across all lines of businesses, as I think one person described to me, and it's a very technical term. No, just kidding. That we all got a little crispy. So people got a little crankier, a little bit more emotional. And then there was quite a gamut on what the mental health challenges were for people and how we dealt with something that nobody had really good experience with. So our productivity didn't dip, but my worry for the well-being of our employees on how much they were working rose. So that's the kind of, we shifted from asking for a little bit more to asking, are they giving themselves breaks? Are they taking care? Are you getting out of the house? And I think that's part of the benefit of the hybrid model is people aren't sinking into depression while they're home alone without somebody being there to help. And so we've kind of broadened our discussions about what well-being means to our employees. But productivity has not been an issue. We've been off the charts with it. So as a business leader, I think it might highlight that my old paradigm and where I was stuck, like Robert said, was antiquated, and I think we're a better organization for the new place we're in.
Yeah, to some degree, those of us who are baby boomers need to be thinking like millennials and Gen X's, I guess.
Yeah.
You know, it is a way to manage. You know, I'm glad you brought it up that you have seen that productivity is not the issue in the home environment, the hybrid model, that you can actually manage that. It kind of reinforces some basic principles of hiring well, setting the expectations, giving them the tools, support, I'm hearing. And then perhaps the one we didn't mention is get out of their way, huh? Great. Scott, I have a couple of questions in your unique perspective for mental health. Mm-hmm. So this question is, what are you seeing from a mental health perspective that is different during the pandemic? And if I could trouble you to think about that from a community perspective, you know, all the patients that come through, the needs in the community, and then I'll ask you a follow-up on staff, but start off with that broad perspective of what are you seeing in the pandemic with mental health?
Well, really not that much different, Ed, from everything we're all reading each and every day. Obviously, the impact on our mental well-being and our mental health as a community, we've taken a beating, so to speak, because of the pandemic. And like listening to Jim and Robert, for sure, I commend both of them for being so employee-centric on their mental well-being. And I think a lot of those compassionate employers in the area, they got their employees home early on because it was safe for them physically, but I think it was also safe for them mentally. So we all kind of rushed to our house to work as much as we possibly could because it was in the best interest of our employee and I think our customers. But I think we're seeing that's taken a toll a bit around the isolation issues and just the sheer stress that people have been under in terms of not only being an employee, but also being a school teacher for your children and just keeping up with everything that we all had to experience as individuals in our community. The pandemic definitely has taken a toll on the healthcare delivery system. We've seen a lot of folks leave healthcare and just go on to different career. So to no surprise to anybody, I think most people know that we have a real shortage here in our community. And I would define the community as the nation in terms of behavioral health providers. So prior to the pandemic here at Acadia Hospital, we might have 350 to 400 people on a wait list for outpatient services. Today, that wait list is getting close to 5,000. Wow. So, and it's not because our team isn't doing fantastic work to take care of almost as many people as we were prior to the pandemic, but there are fewer and fewer and fewer resources out there. So anything we can do in the employer space to do exactly what Jim and Robert mentioned, to be more flexible, be more empathetic, be more understanding to the needs of our employees, really be better listeners, respond quicker, make deeper investments in what our employees need from us. And that will go a long ways to help out with the mental health challenges we have from a broader community perspective.
I can't help but mention your staff who have been tremendous, tremendous in terms of supporting the 12,000 employees of Northern Light Health, but also tremendous as panelists on this particular webinar series. They've really supported the knowledge base of our participants tremendously. So thanks to your team and you, Scott, for all of that. We appreciate that very much.
Our pleasure.
So while I have you on video directly, talk just a little bit about how you supported your staff through this all. I mean, they're busy supporting the rest of us, but they need you to support them, I'm sure. To talk about that a little bit, maybe some insights.
Yeah. Prior to the pandemic, I always felt that we were really making good investments in our workforce and spending, time with our employees in a helpful, productive way. But, I was a little bit asleep at the switch when I look back on it. Regardless of what level of investment you're making in your employees today, it's probably not enough. And when investment in our employees doesn't necessarily mean, financial investments. Obviously, they need to be paid competitively, but everything we've learned, Ed, through communication. When we started out, we were having, almost daily updates with our employees. We were sending out written communications 2 or 3 times a week. And at some point, our employees said, okay, Scott, we got it. We're on top of this, enough's enough. And that's good. That feedback is very helpful. And building that sense of comfort and trust is really important. So I think the importance, what I've seen, Ed, is that continued investment in your people. It has to be your top priority. We all sort of know that. I think for the most part, we thought we were doing a good job with that. But when things really get ugly out there, like we've seen through the pandemic, that loyalty that truly is bi-directional will carry the day if you're making the right investments in your people. And we try to do more and more with appreciation events, whether it's sponsoring a breakfast in the morning to get them off on the right foot, a free coffee day, me just meeting them at the door, which I did more of early on in the pandemic, getting up on the units, getting out in the community, just to say thank you, and doing that in a genuine, sincere way. Because as you said, Ed, healthcare workers, really, there are a lot of heroes in the healthcare space today, and they've carried a tremendous load. Not that it hasn't been a tremendous burden for everybody, but those here at Acadia and throughout all of the healthcare space, they truly are our heroes, and we need to do more for them. So.
Thanks for that. So it sounded like visibility was really important. I can't help but think that we're in chapter 2, management by walking around, huh?
Yeah. And, as much as I do that, it's not enough. And one thing I learned too from this, I didn't realize how much energy I got from our workforce. When a lot of our workforce went home, because part of our strategy was workforce separation and preservation, we just didn't know how our inpatient units were going to stand up. Those folks had to come to work every day. Nurses, therapists, doctors, they needed to be in here every day taking care of our inpatient. But most of our outpatient staff, they went home. This hospital got pretty quiet in a hurry. And, it was enlightening to realize I felt I've always appreciated our employees, but I didn't realize how much I depended on them to re-energize me each and every day through their physical presence. So really, it's me that needs to thank them for, what they do for me every day.
Awesome. That certainly sounds like a critical lesson learned, huh?
Absolutely. One of 1,000.
So as we wrap up today's session, I'm going to ask all 3 of you to please share a key takeaway you'd like to offer our audience. We'll start with Robert.
Excellent, thank you. I think looking back on the last 2 years, the key takeaway is prepare for the long haul. And looking back in March of 2020, as we counseled with everybody around me and in the company and in the community, we didn't really know what we were dealing with the pandemic, and so preparing for the long haul is an understatement of how you're gonna not quick hits to the employees, quick hits to the customers, where you're just trying to reassure temporarily. And that's what we were doing. We're in a little triage moment there for a little while, and then we just had to settle in and really build the infrastructure and our methodologies and our process around for a long haul uncertainty, and make that as comfortable as possible, as well as the second layer of that, as well as is hunt for the transformative opportunities while you're in this very uncomfortable experience of taking care of the community, your employees, and your business. What can you do transformatively in that you would never ever have been awake to, or overcome your biases in, to make yourself a better operator and a better employer and a better community member? So just fighting those things as you're going through panic, and you settle out of panic and crisis and fear, you start settling in, okay, this is going to go away and we'll get back to normal. You just got to push through that and build your system for a long haul pull, and then search and hunt for those transformative things that you can just be better as a result of what you're experiencing. And that's kind of what I would impress upon everybody. I didn't start 2020 with that in March. I just grew that through the last 2 years in my insight looking back.
Excellent, Robert. I see that as finding the opportunity in adversity.
Yes, exactly.
Oh, that's
exactly.
great. That's great. Jim, a key takeaway that you picked up in the experience you'd like to share?
Oh, it's so hard to narrow it to one. I guess I would start with never pass up an opportunity to show appreciation or exercise kindness. And I know that might sound a little trite and light, but we found out that there are a lot of people who you're going to need tomorrow, and they need to know that you appreciate them today for them to make the right decision for the organization tomorrow. Also, the kindness, you don't know what somebody else is dealing with. And that's been true forever. When somebody's a cranky customer and you tend to get annoyed with them, you just don't know if they got bad news somewhere else. So try to be kind. For the business operation, it is that learn to build our organization to be more nimble and more flexible than it traditionally has been. Like healthcare, we're riddled with rules and regulations, and there are lots of landmines in those for us to be in trouble. And sometimes we use those as a crutch to support our inflexibility on things, or to make things just purely black and white. And life's just not that way. So giving more frontline people the ability to make decisions and support them in those decisions to help our customers and our communities has been one that we've really come with.
Excellent. Thanks for that, Jim. I'm going to squeeze in one last question from our audience here that I'll try to answer. With workers re-entering the workforce, masking being more flexible, let's look 4 months down the road, if possible. People's guards begin to drop. Should protocols and symptom knowledge remain in place indefinitely? So I'm going to tap into Dr. Jarvis's crystal ball for this one. 4 months is a long time, and we're cautious that another surge could happen like it did with Delta in August of last year. I think if you look through the material that Dr. Jarvis shared, it's a way of adjusting the decision making accordingly, based on what the community transmission is, understanding what's out there, and we're fully prepared to slowly drop some of it. So we're treating direct patient care environments differently than our office buildings right now. So I think being flexible and tuning into the materials that Dr. Jarvis had shared should be able to answer that more completely on an ongoing basis. So, Scott, I'd like to give you a chance for that 45-second wrap-up takeaway so that I have a little bit of closing time.
So addressing sort of the environment, I think we have to react, Ed, just to facts and circumstances, what's going on in the environment. Looking down the road, we will continue to be very mindful of the environment. We will always be cautious given the business that we're in, but employees are looking for a break, and we want to make sure we give them the relief that they need at each and every day around the appropriate protocols. We don't want to drop our guard too early, but we don't want to continue. We don't want to overreact either. There's a balance that needs to be had out there. We need to be very mindful of the needs of our employees and our patients as well.
Excellent. Well, thank you for that, Scott. We've included some tools for you at the end of this presentation. Thank you all for joining us, and thank you to our panelists. I hope this hour of shared learning has been a help to support you as you lead your employees through the many changing phases of the pandemic. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information. Our next session will be on April 7th. We'll share the latest on COVID-19 and address delays in seeking healthcare. We'll share the consequences of delaying healthcare, including possible impacts on your company's healthcare costs. At the end of this session, you'll know what healthcare issues to pay attention to, what care to encourage your employees to engage, and an understanding of why this is so important. We hope you will join us. We will send you the link for this session. We encourage you to share the invitation with your friends and colleagues. By working together to promote good health, we will be promoting good business. Thank you and have a good afternoon.